Hello everyone, welcome to my channel. Today, we are going to discuss about hypertension, management in Ayurveda, and interpretation with doshas. Did you know hypertension is a silent killer? Many people walk around with high blood pressure without even realizing it. It's a Gudalinga, Avyakta Vyadi. It means hides itself until it's too late. That's why checking BP regularly is a must. It takes just 2 minutes and it can save lives. So, without use of sphygmomanometer, it is difficult to diagnose. Now, let's talk about why hypertension happens. In blood pressure, 3-dose involvement is seen. Usually, there will not be any lakshan. Very few people complain of headache, etc. It is incidentally diagnosed when they come with other diseases. So, it is essential to check BP in all the persons. It takes only 2 minutes. Concept of Shofa, Gulmroga, Moodvata, Shrotorod, Manodushti are all involved. It is not one thing. Chala Guna of Vayu, Ushnata, Tikshna Guna of Pitta, Snigdha and Manda Guna of Kapha are involved in these cases. Hypertension is nothing but high pressure in the arteries and it is abnormal. Many people use the word nervousness for the term hypertension. This is not correct. It is our duty to teach the patient that it is an asymptomatic disease. Many of the heart failures and kidney damages are the results of untreated hypertension. Value above 140 by 90 mmHg is considered high. Many patients even with 180 by 110 mmHg do not produce any symptoms. Blood pressure of 210 by 110 mmHg is a malignant state. Many times we are unable to find out any cause. Nowadays, many young people are known to be hypertensive. Many women who take contraceptive pills become hypertensive. And many kidney disorder can cause hypertension. If a young person is known to be hypertensive, we have to rule out renal artery stenosis. By doing renal arterial Doppler and check renin angiotensin converting enzyme. In Cushing's syndrome, there will be high BP. It is due to high level of cortisol. Obesity, stress, smoking, alcohol, high salt in the diet also contribute. Very rarely we see headaches, dizziness, fatigue, nosebleeds. Untreated hypertension can damage brain, eye, heart and kidneys. Hypertension should not be confirmed from a single reading. When we are measuring blood pressure with a sphygmomanometer, the level of the apparatus should be equal to the level of the heart. Now coming to management through Ayurveda. In Ayurveda, it is a Gudalinga, Avyakta Vyadi. If lakshanas are seen, we can interpret them into tridosha. Many times lakshanas are not seen. Lakshanas can be Vataja, Pittaja or Kaphaja. Sarpaganda is not a solution to all forms of hypertension. Of course, it is having an anti-hypertensive property, but it is not all kind of high blood pressure. The plant which is available in the market mostly is not Sarpaganda, but we believe that we are prescribing Sarpaganda. Following 3 approaches are useful in hypertension. As a Vat Anulomna, as Shroto Shodhana, as Shophagna. First one is as Vata Anulomana, Kashaya like. Gandharv Hastadi Kashaya. 20 to 30 milliliters morning and night before food, along with adding some jaggery or little amount of sendva. In Vati form, Dhanvantar Gutika. 3 tablets twice a day along with Kashaya before food. Sukumar Aaron Tel. 10 milliliter रात को सोने से पहले. Talam, it is one of Panchakarma. Procedure. In this condition, we are using Kshirbala Tel with Rasnadi Churn as a talm. Now coming to as Shroto Shodhana Oshad. Guggulu like Navaka Guggulu, 1 tablet in BD dose with Kashay. Dashmula Haritaki, 20 grams at bedtime. Sukumar Leh, 20 grams at bedtime. These are helps in clearing the channels as Shroto Shodhana. Now as Sofagna many Kashay are used, they are Dashmula Kashay, Punarnavadi Kashay, Patya Punarnavadi Kashaya, Ardhvilvadi Kashaya, Trina Panchamula Kashya, Brihatayadi Kashaya. They are taken as dose of 20 to 30 milliliters morning and night before food. Dashmula Haritaki 20 ग्राम सोने से पहले गर्म पानी के साथ. Are used as sofagna. In many conditions, we don't have drugs equal to calcium channel blockers or alpha-1 receptor blockers. Some people need help from modern medicines. Many people take modern antihypertensive drugs. An Ayurvedic doctor should be aware of its complication. Calcium channel blockers like nifedipine and diltiazem will produce pedal-edema. ACE inhibitors, that is all word ending with pril, for example enalapril, lisinopril, etc., will produce cough. We should always remember these points. Some doctors prescribe Mutra Virechniya Gan, Gokshur, Shatavari Paniya when systolic pressure is high. This is also a good approach. There are mainly 3 conditions in BP and we are correlating with Ayurveda aspects. Their first one is high systolic pressure with normal diastolic. In this condition, we will give medicine which are Vat Pittahara, Shothahara, Mutrala, like Brihatyadi Kashaya, Dhanvantar Kashaya, Mutra Virechniya Gan Kashaya. Advise patient to reduce salt intake. Second condition is normal systolic with high diastolic. In this condition, we will give Vat Kafara Dravya, Kashaya as Rasonadi Kashaya, and Dashmul Haritaki, 2 tablespoons night after food. Third condition is high systolic with high diastolic pressure. In this condition, we will give Shothahara and Tridosha Hara Dravya. Kashaya are Drakshadi Kashaya, Brihatyadi Kashaya, Dashamula Haritaki, Yoga as Kashaya form, and Sukumar Erandam, 5 milliliters at night with milk daily for 21 days. And the truth is, although these medicines are suggested, results are not always satisfactory. Final advice: if you have high BP, don't ignore it. Check your BP regularly. Make lifestyle changes today. Follow Ayurvedic treatments with patience. Consult a qualified Ayurvedic doctor before taking any medicines. Your health is in your hands. Take action now. In next video, we will discuss about low blood pressure with Ayurveda management, orthostatic hypotension, postprandial hypotension. If you found this useful, like, share, and subscribe. Let's spread the power of Ayurveda together.